Hi, this is Amanda Lawton, an Indiana State University LPN to BSN student, Community Health Nursing, Health Education Project number 6, discussing eating disorders in adolescents. Upon completion of this video, the viewer will be able to identify 3 types of eating disorders, identify 4 risk factors of eating disorders, identify 6 signs or symptoms of eating disorders, identify 4 treatments for eating disorders, identify 3 preventative measures for eating disorders. Please stop here for a moment to take a pretest to assess your knowledge of eating disorders in adolescents. The link is provided in this slide. In the United States, as many as 10 in 100 young women suffer from eating disorders. Eating disorders are complex illnesses that are affecting adolescents with increasing frequency. They rank as the 3rd most common chronic illness in adolescent females, with an incidence of up to 5%. Teens with anorexia fear gaining weight and are at least 15% below their ideal body weights. 3 major subgroups are recognized as eating disorders. A restrictive form in which food intake is severely limited, known as anorexia nervosa. A bulimic form in which binge eating episodes are followed by attempts to minimize the effects of overeating via vomiting, catharsis, exercise, or fasting. This is known as bulimia nervosa. And a 3rd group in which all the criteria for anorexia nervosa or bulimia nervosa are not met. This 3rd type is known as avoidant restrictive food intake disorder. It is another eating disorder which can occur in younger children or adolescents. It involves a disturbance in eating or feeding, which includes a substantial weight loss or a lack of expected weight gain, and nutritional deficiencies. It can lead to dependence on a feeding tube or dietary supplements. We don't know why some adolescents develop an eating disorder and others don't. However, many factors might influence an adolescent to develop an unhealthy eating pattern or to become afraid of gaining weight. These factors may be psychological, social, environmental, or biological. Often a combination of things may trigger an eating disorder in a vulnerable person. Psychological risk factors include low self-esteem, perfectionism, difficulties expressing feelings like anger or anxiety, being a people pleaser, difficulties being assertive with others, and fear of adulthood. Social or environmental risk factors include being teased or bullied, a belief that high expectations from family and others must be met, major life changes such as family breakup or the accumulation of many minor stressors, peer pressure to behave in particular ways, a parent or other role model who consistently diets or who is unhappy with their body, media and advertising images of the ideal body size and shape as slim and fit, a cultural tendency to judge people by their appearance. Biological factors are adolescence and its associated physical changes, genetic or familial factors, for example, families that are overly focused on food, weight, shape, and appearance. Dieting is also something that increases the risk of developing eating disorders. Dieting is common among adolescents and normalized by society, but it is not a healthy behavior and should not be considered a normal part of being an adolescent. Eating disorders such as anorexia and bulimia can be triggered by dieting. Boys and girls experience eating disorders. They're more common in females than males. However, about 25% of cases in adolescents occur with males. If left untreated, eating disorders can lead to serious illness and even death. Along with lower body weight, girls with anorexia nervosa can lose their menstrual periods. The loss of periods associated with osteopenia, early bone loss that can lead to painful fractures. Eating disorders are also linked to other serious health problems such as kidney disease and heart disease. Each of these health problems requires specific tests and treatment. Parents frequently wonder how to identify symptoms of anorexia nervosa and bulimia. These disorders are characterized by a preoccupation with food and a distortion of body image. Unfortunately, many teenagers hide these serious and sometimes fatal disorders from their families and friends. The signs of eating disorders can vary depending on the type of eating disorder. Each person may experience symptoms differently, but some of the most common signs of eating disorders include the following. Emotional and behavioral signs of eating disorders are preoccupation with weight, calories, food, carbohydrates, fat grams, or dieting, a refusal to eat certain foods, skipping meals or eating small portions at regular meals, attitudes that indicate dieting, weight loss, control of food, any new preoccupation or practices with fad diets or food, including removing entire food groups, withdrawal from friends and activities, extreme concern with body shape and size, extreme mood swings, and frequent dieting. Physical signs of eating disorders are noticeable weight fluctuations, menstrual irregularities, difficulty concentrating, fainting or syncope, stomach cramps or other GI complaints, frequently feeling cold, sleep disturbances, bizarre eating behaviors, excessive physical activity, dehydration, dry skin and hair, brittle nails, muscle weakness, discoloration of teeth or cavities from vomiting, swelling around salivary glands, poor wound healing, cold hands and feet, or swelling of feet. With comprehensive treatment, most children and teenagers can recover from eating disorders. The child and adolescent psychiatrist is trained to evaluate, diagnose, and treat these psychiatric disorders. Treatment for eating disorders usually requires a team approach, including individual therapy, family therapy, working with a primary care physician, working with a nutritionist, and medication. Many children and adolescents also suffer from other problems, including depression, anxiety, and substance abuse. It is important to recognize and get appropriate treatment for these problems as well. Different kinds of treatment include psychotherapy. Psychotherapy is an essential part of treatment delivered on an individual basis approach in inpatient, day patient, or outpatient treatment. Cognitive behavioral therapy brings clarity and valuable insight for a teen in crisis. Cognitive behavioral therapy identifies the emotions that often result in a sense of isolation. It addresses in a positive way the self-defeating thoughts and assumptions that make life more difficult. Adolescent focus therapy aims at identifying and scrutinizing eating disorder symptoms in the context of developmental challenges. And family-based treatment. Parents' skills are strengthened to promote their children's weight gain and the normalization of eating disorder symptoms. Prevention of eating disorders. Prevention of eating disorders includes encouraging healthy eating habits. Discuss how diet can affect your health, appearance, and energy level. Encourage teens to eat when he or she is hungry and eat together as a family. Discuss media messages. Television programs, movies, and social media can send the message that only a certain body type is acceptable. Teens should be encouraged to question what he or she has seen or heard. Promotion of a healthy body image. Talk to teens about his or her self-image and offer reassurance that healthy body shapes vary. Don't make or allow hurtful nicknames, comments, or jokes based on a person's physical characteristics, weight, or body shape. Share the dangers of dieting and emotional eating. Explain that dieting can compromise teens' nutrition, growth, and health, as well as lead to an eating disorder. Remind teens that eating or controlling his or her diet isn't a healthy way to cope with emotions. Instead, encourage teens to talk to loved ones, friends, or a counselor about problems he or she might be facing. Please stop here for a moment to take a post-test to assess your knowledge of eating disorders in adolescents. The link is provided in this slide. This is information on different signs and symptoms of eating disorders, behavioral factors, and then also there's some information here regarding eating disorders in adolescents and some different helplines, and there's also a text line and a website.